Thank you, Mr. Chairman. You have 5 business people in a row here. I spent 35 years in business, running all kinds of businesses, owning, operating, from aerospace to agriculture to banking, and then 34 years in McDonald's franchises. I've never seen something so convoluted as the healthcare industry in this country, and it hasn't gotten simpler. Having seen hundreds of thousands of dollars taken off the bottom line and wasted when you could supply health insurance to your employees. In any other industry, you'd know the cost of service of the product you're buying, and as a consumer, you can shop and for the best price. But in healthcare, people have no idea the true cost of their healthcare service or the treatment. It's the only thing you buy, if you think about it for a minute. It's the only thing you pay for that you don't know what the cost is before you get it. The exorbitant costs of the healthcare are masked by subsidies, tax credits, employer and insurance contributions. Not a single person in this room could tell me the true cost of their last healthcare appointment, and that's the problem. Unfortunately, the hidden cost of healthcare exacerbated by the Democrat policies. Just last year, my colleagues on the other side of the aisle voted to completely hide the cost of health insurance under the disguise of free, zero-premium health care for many Americans. The expansion of the Obamacare subsidies cost the American taxpayers $64 billion, but the greatest cost of all is to the society. We need a safety net for people that are falling on hard times, falling through the cracks, but not families that are making upwards of $600,000 as we're currently seeing. We need safety net that empowers people. Hiding the cost of health care through government subsidies blindfolds families who are already struggling to pay their bills under Biden inflation. We shouldn't be surprised that Democrats keep pushing for these policies. My colleagues today will point to reports with increasing enrollment in the Obamacare markets and Medicare rolls. It's not a victory to have a health insurance card in your pocket but no cash in your wallet. I think you said that earlier. Yeah. Especially if the service that comes with the health insurance card are too expensive. Democrats are misleading Americans, telling them that they have care when all they have is a plastic card. The actual care costs are even more. Coverage mandates began with the passage of Obamacare over a decade ago. Since then, Democrats have continued to almost exclusively focus on those policies in the individual market, have done nothing to help the 48% of Americans who obtain their coverage from their employer. It should come as no surprise when there have been no work for Democrats to salvage their failed small business exchanges and small business health tax credits. I would encourage my colleagues to go to healthcare.gov/smallbusiness and see for yourself the small businesses have no options for coverage in the SHOP exchange in many states, including my own home state of Oklahoma. And no SHOP insurance means no access to the small business tax credit, which explains why only 6,000 people used the small business tax credit in 2016. Let me say that again. There are 33 million small businesses in America, and only 6,000 were using the tax credit. It's really sad that Democrats could expand Obamacare tax credits for a family making nearly $600,000, but do nothing to fix Obamacare's broken small business provisions. But this is a new day in the House of Representatives. The American workers spoke loud and clear last November. America's workers are tired of being left behind and punished for pursuing the American dream. I'm proud of the healthcare policy platform we put together and the commitment to America with the Healthy Future Task Force over the last year. As chairman of the Task Force Affordability Subcommittee Chairman, I want to quickly highlight some reforms that this list that our committee should consider. Make healthcare, first one, make healthcare coverage portable through ICRAs, make healthcare savings accounts accessible to more people, reduce the Obamacare paperwork burden on small businesses, and allow businesses to join together through association health plans. Mr. Blaze, we've spoken many times. You did a lot of great work on that year of work. We've seen a highly mobile labor market, and now more than ever, workers need health care that is portable. Can you speak to how health and reimbursement accounts provide American workers and employers more flexibility?
Yeah, thank you, Congressman. It's the new individual coverage health reimbursement arrangement. They took effect in 2020, and it allows employers to offer a contribution that workers take and then buy the individual plan that works best for them. So it's really, it's the small business owners, they care about their workers, they want to offer them health coverage. It's about trusting people to make the best decisions for them and giving them as many options as possible for their coverage.
What's been the effect of the expanded subsidies on the employer market? CBO and JCT estimate that 2.3 million employers would drop coverage, and do you agree with that estimate?
Yeah, I actually think it could be more than that if the expanded subsidies are made permanent. The expanded subsidies are really large, so it provides employers with an incentive to drop coverage. They could increase wages when they drop coverage and have their workers qualify for expensive tax credits in the exchanges that just add to deficits and just worsen the overall inflation problem.
Thank you, and I yield back.